and welcome back to part 2 of our discussion of online mags on facelift and mini facelift. Before surgery, the main thing that we recommend is that you stop all supplements, all blood thinners, and all herbal or traditional medicines. These can increase your bleeding and cause something called a hematoma to develop under the skin flap. In the face, because the flap is so thin, the residual effects of this hematoma can be quite long lasting. So in the main, where it's more about avoiding certain things rather than eating more of other things. Sure. So the duration of surgery depends very much on the procedure that you're doing. I think a mini facelift can be done in about 2 hours, about 45 minutes on each side, as well as taking time to dress and make sure the patient is comfortable. Facial fat grafting with a blepharoplasty also takes about 2 hours. A traditional facelift can take up to about 4 hours to complete, while the deep plane facelift, often the surgeon will only do 1 a day, because if he does it completely with the fat grafting and the blepharoplasty, it can take about 6 hours to do. So aftercare for a facelift, we can divide it into early and late, as well as skin resurfacing. Early care is just to really take care of the wounds, take care of the incisions. Often you're advised to sleep with your head up for the first 3 or 4 days, and to avoid anything that would cause your blood pressure to rise, as this could increase swelling and bleeding in the face. After that, we do recommend for everybody good skincare, and the basics of skincare start with sunscreen. And then obviously in terms of rejuvenation, either looking at retinol or vitamin C as your cornerstones, and the addition of moisture, usually via hyaluronic acid. Those are the kind of 4 essential factors that you have to have in your skincare routine. It wouldn't make sense to have a facelift and not take care of your skin, right? And now if you look at that and you take that a little bit further, what we often recommend is to do some skin resurfacing. So if you are coming for a facelift and you're in your 60s, but you want to look maybe mid-40s, early 40s, then you should resurface the skin using a variety of techniques, either a peel or a gentle laser, just to rejuvenate and give you the skin that matches your cheekbones. Successfully done surgery should include revolumizing of the cheeks. So you shouldn't really have to do fillers again after surgery. There is one area, if you look, this forehead area, even if you could do something else, Botox is so effective in that area, in clearing up the active lines, in giving your eyebrow that nice arch, that we still do recommend the routine Botox after surgery. But the fillers, really, if you've done the lifting from the facelift and you've done some fat grafting, you shouldn't need to do fillers again for at least 10, 15 years after the facelift. Well, the swelling is always temporary, but the scarring is permanent. So the scar from a facelift often is very well hidden just in front of the ear. It's an area that has a natural shadow, and especially in white skins, the scar is very, very invisible. In black skins, it can be a little bit, because black skin scars darker, it can be a little bit visible. And for that reason, I think that's another reason why more and more black people are opting for a mini facelift, because this scar is very easy to hide. But if you extend it onto the lateral forehead here, it is quite difficult to hide that scar, especially in our population with problems like traction alopecia. You can find that the scar is initially well hidden, but as you age and the hairline recedes, it becomes a bit more obvious. So that is also a reason why people would opt for a mini facelift as compared to a traditional facelift. The initial swelling from a facelift should subside within 10 to 14 days. After that, it will continue to improve, and you should be able to see your final result at about 3 to 6 weeks. Normally closer to 6 weeks, we would say your swelling is almost entirely gone. Well, so if you do the surgery on a Tuesday with me, then you would come in to see me the following day, which is the Wednesday. And then I would see you the following Monday. We would skip one Monday, and I'd see you another Monday. And after that, I would see you at about 3 months, just to make sure everything has settled nicely, including where we've possibly placed fat, and to look and assess the scarring, as well as all facial function. How much does a facelift cost? I think it varies depending on the type of facelift. So the best is to get a full assessment. And if you look at the range, it can range from about 85,000, where you are only doing the facial fat grafting to revolumize and including an upper lid blepharoplasty. That can be about 85,000. A full facelift with a traditional facelift is about 120,000. And the deep plane facelift, which is the Rolls Royce of facelifts, can be at about 160,000 or more, depending on, it all depends on the extent of what you want to do. Some people need eyelid surgery, some people need facial fat grafting, some people only need the wrinkles to be removed. So it varies depending on your needs. But we will, at Marang Aesthetics, always make sure that we choose the best procedure to suit your face.